Hello everyone. Today I'm going to demonstrate how to wear surgical mask
and N95.
I'm going to show two types of surgical masks. One is with a rubber band and the other one with tie bag.
Perform hand hygiene. Check for any defect, the color and the metallic strip to be upside. Hold the mask through the earlobes and the color side outside. Ensure the mask fully covered the nose and the chin. Pinch the metal edge of the mask. Remove the used mask by holding the rubber band and dispose. Examine for any defect, the color and the side properly. Put mask on your face. Tie upper band first at the crown of the head and tie the lower band below your head. Fit the mask under the chin and nose. Adjust the nose piece to your face with your fingers and tie the band in butterflies. For untying, untie the lower first and then the upper band and discard it properly. For N95, choose the correct size and ensure there is no defect. Hold on your palm with the straps hanging freely below. Put the mask under your chin with the nose piece up. Pull the upper string followed by the lower string below your ears and hair. Adjust the strap and mask. Using both hands, set the nose piece by pushing downward and outward. Perform fit test by placing both hands over the mask. Do not disturb the position and exhale sharply. If there is an air leak, adjust again the straps with your finger and perform fit test again. To remove, pull the bottom strap overhead and then the upper strap. Do not touch the mask and discard inappropriate dustbin. Perform hand hygiene.